Okay, all right. So hello, dears. Ayan. So welcome to yet another pre-recorded in your bacteriology class. And I think this is the third to the last na pre-recorded lectures nato. And still, we are going to discuss the different specimen collection, handling, and processing of this time blood. Okay, so we're gonna talk about blood culture. All right. Okay. So I apologize if akong itsura kay medyo stress na medyo with the dark circles and all. I know usual na ako ng itsura para namang may nag-iba. Pero now it's much more siguro evident kay kulang kong tulog gabi eh. Yes, kay nag-party. Joke lang. Nag-mag-exam and all that. But anyway, alright, so pasensya lang daan. Ayaw na laglan sa akong face, just listen to my beautiful voice. Alright? Basta hindi nyo ma-tolerate akong face. Anyway, alright, so we're going to talk about again blood culture. Alright, now in my internship personally, when I was still a student like you, sa third year, bakte, I was thinking na, unsa na ganing blood culture, like tinuod ba gyud na specimen? Like, in the real setting sa lab, are blood cultures like really requested by the doctors? And to answer that, yes, actually. And I was fortunate enough, both sa Galyares and Soto, na I was able to collect samples good for blood culture. All right? And also, I was able to process sa microbiology section sa laboratory, mga blood culture na ni positive. All right? So we'll talk about that later. But yeah, so tinuod ni siya, guys. Actually, tanan natong ipang chika diri sa bakte from the start, tinuod ni siya. So dili ni siya fiction. They all happen in reality. All right? Kaya basta na mo nagduwa-duwa mo na, hala, ano dagay ni mga mugna-mugna na dagay chika-chika lang. No, these all happen in the real setting. All right? So again, this lecture will comprise topics or lessons or concepts about blood culture. So how do we culture blood? All right. Okay. So we'll start first with some terminology. Of course, first we have the word bacteremia. So when you say bacteremia, by the name itself, bacteria, emia. So when you say emia, blood, so meaning bacteria in the blood. All right. So na ay presence of bacteria in the blood. All right. And this presence of bacteria in the blood will lead now to the growth in our blood cultures. All right. Next, we have occult or unsuspected bacteremia. So by the name itself, diba sa inyong AUBF na occult blood. So when you say occult, it's hidden. Alright, so it's not seen. Alright, so same here, meaning occult bacteremia, unsuspected. So the patient could be experiencing normal symptoms lang or wala na dyan siya na experience, but then nanay kagaw na nagsuroy-suroy sa iyang blood. Alright? Okay, so that's occult. So again, bacteremia without any signs and symptoms of severe infections. Alright? Next, you have also what they call pseudobacteremia. When you say pseudo, di ba, sa una pa lang sa inyong histo or other subjects, when you say pseudo, it's like false, di ba? Pseudo is like true, kunuhay, or pseudo means like trying to imitate the original one, something like that. But it's fake, di ba? Oh, may mga fake ko dyan. Charot lang. May mga pseudo friends ba kayo? Charot. Okay, anyway, when you say pseudobacteremia, naay ni grow sa imuhang blood culture, alright? But it's not a pathogen, okay? Or it's not causing any disease. So, ang ni-grow na dito is contamination during phlebotomy. So, example, mga cons, coagulase neg staph, like staph epidermidis, may nana. Because again, they are normal flora of the skin. So, they could lead to contamination, alright? And when, when blood cultures have those kind of growth na makaingon ka na contaminant ra siya, not the pathogen that's causing the disease, then that's pseudobacteremia. So it's not a true bacteremia, it's just pseudo. Okay? All right. Next, we have septicemia. Now, di ba, if nakadungog mo, di ba, mga sepsis, mga inanaka ng bacteremia, septicemia, so unsa may difference nila. Ang septicemia, manggod, is there is really like replication, di ba? Bacteria are present in the blood, producing an infection, and they're reproducing within the bloodstream. So, ang bacteremia is just like bacteria na nag-swim ragid sa blood. But when there is septicemia na, it's bacteremia na naanay mga symptoms na marag intense. Okay? So, muna siya sepsis, septicemia. Alright? So, again, septicemia, bacteria is actively replicating within the bloodstream, or actively growing. Alright? And because of that, they now lead to the presentation of symptoms sa imuhang patient. Alright? So, septicemia. Okay. Sorry. Okay, all right. Now, again, these are some terminologies. All right. Next, we have systemic inflammatory response. When you say systemic inflammatory response, again, a spectrum of increasingly severe conditions from sepsis to severe sepsis to septic shock. So, again, mga complications na. of your bacteremia or septicemia. Okay? So it's a response by the body, or it's a response made by the body in reply or in connection to the presence of bacteria in the blood. All right? Okay. And again, you have sepsis. It's an infection with a systemic inflammatory response. So na bacterial infection and nagsugod na og kaapekto ang different parts of the body or internal organs ba. You have severe sepsis. Ang sepsis, di ba, kay na-affected na ang organs, but dili pa kayo na naka-intense. Okay? When you go severe sepsis, nagsugod na og, deteriorate ang organs, naghinay-hinay, nag-organ dysfunction, low blood pressure ba, or na-ay low blood flow. Alright? And all of these, kung dili maagapan, will lead to septic shock. So when you say septic shock, because again, low blood pressure na, okay, and low blood flow, this could lead to kanang wala na proper fluid distribution sa body. So muna magka-shock na kaya wala na the body's tissues are not getting, okay, the needed mga materials or mga fluids, right, from the body, from the bloodstream because again of these inflammatory responses. Okay? All right. Ayan. So we now go to bacteremia. So napag siya classification ng bacteremia. All right? So we classify them first by site of origin. So when you say primary bacteremia, the bacteria are present in an endovascular. So meaning primary good, it's really gikan siya sa kanang murag source of blood in a way, or na siya sa within blood vessels. Example, cardiac valve or mga intravenous catheter. So when you say primary bacteremia, the bacteria really came from like a blood vessel ba, or the heart, the valve, which in a way dra dyan magikan ang blood or magflow ang blood. Okay? So muna siya ang primary bacteremia. Now when you say secondary, it came from an extravascular source. So when you say extravascular, so example, na wound, all right, na kay wound infection, nawala na agapan, and because of the wound infection, nawala na agapan, the pathogen that's causing the wound infection now is able to spread to the blood because of the blood vessels surrounding the wound infection. So basically, when you're saying secondary bacteremia, nagka-bacteremia ra ka or nagka-bacteria emuhang blood because of another reason, okay? It could be a wound ba, like any infected lung in patients with pneumonia, basta dili siya coming from the blood vessels mismo ang kagaw, okay? So, di ba, ang primary bacteremia, the bacteria was really introduced to the blood vessels ba or the heart valves in ana, those that really supply or those that areas where the blood flow, right? Ang secondary, whereas ang secondary, you already have an existing other condition, bacterial condition. Example, again, wound infection ba sa skin, lung infection, bacterial infection, that wala na agapan, okay? And because of that, ni spread ang kagaw to the neighboring mga blood vessels, di ba? Therefore, causing bacteremia, okay? So, I hope na gets yung difference sa duha. Alright, okay. And next, bacteremia of unknown origin. This, by the name itself, unknown origin, or idiopathic, ayan. Nalimot ko sa term habit, idiopathic. Alright? So when you say idiopathic, you don't know the source or asa na siya gikan. Alright? So idiopathic, ikutasan ko. Idiopathic, so you don't know the source of the infection. So nagka-bacteremia ra siya pero you cannot really point out asa gikan ang infection. Okay. Alright. Next, by causative agent, of course, it could be of different bacteria. Bisag kinsa pwedeng makakos og bacteremia. Pwedeng gram-positive, gram-negative, anaerobic, and even polymicrobial. When you say polymicrobial, daghan kayong pathogens at once causing the disease. Like, 2 ka pathogens ba ang nasa blood, 3 ka pathogens, etc. So, that's a polymicrobial infection. Like, daghan kaayong pathogens ang nag-cause sa infection. Okay? And by place of acquisition, meaning asa siya nakuha, pwedeng community-acquired, but the name itself, community-acquired, self-explanatory, nakuha niya sa community or the people, you know, that he or she or the patient is living with, all right, sa community. Or again, nosocomial, when you say nosocomial, from the hospitals. So, kana mga infected patient, admitted patients rather, in hospitals na medyo okay raw siya pag-admit, then after a while, kaya ni-deteriorate because of sepsis ba or bacteremia, that could be na nakuha niya sa hospital. So, nosocomial, all right? Okay. Ayan. Okay. All right. Next, by duration. So, like, unsa siya kadugay. So, first one is transient. Okay, when you say transient bacteremia, the pathogen is not always present in your blood. Okay, so muna siya. Ay, sorry. Okay, sorry. So, transient bacteremia DI occurs after a procedural manipulation of a particular body. Okay, so example, nag-surgery daw ka og a place or a part of your body that has a lot of endogenous microflora or flora, a normal flora. So, what happens is maybe sa pag-surgery or pag-operate nimo, na-introduce ng mga normal flora sa imong bloodstream, which now causes the bacteremia. Okay, that's transient. Now, for intermittent, bacteria are periodically released from the primary site. So, meaning intermittent is kanang, dili siya every time. Like, naara siya cycle or panagsa ba. Okay, so, periodically, so meaning from time to time, from time to time, gina-release ang pathogen from the site of infection. So, example, meningococcemia, so meningitis, no? Neisseria meningitis, gonorrhea na naana sa blood, Neisseria, so, from time to time lang siya gina-release sa blood. Okay, so that's intermittent bacteremia. And continuous, when I say continuous, the bacteria is always present. Okay, consistently present siya in the bloodstream. So bisag unsa na time of the day, sa imong collection, makita nimo siya or naagid siya. Because again, it's continuously produced. Alright, and usually they're coming from an intravascular source. So when you say intravascular, they are really within your bloodstreams, or the infection is really within the blood vessels or within your bloodstreams. So if na dito ang infection, of course, the bacteria is continuously produced sa imuhang blood. Okay, magsigig shed og bacteria sa blood. That is why ma-detect ka siya sige or any time of the day. That's what you call continuous. Alright? Okay, ayan. Now, who are those at risk or unsay mga risk factors for bacteremia? Of course, number one is those that are immunocompromised and immunodeficient. Okay, so example, those that are of old age, katunay mga like neoplasias, alright, mga cancer, HIV, kato mga na underlying diseases, that would yield the patient really vulnerable, alright, in terms of their immune system defense. Because again, they cannot, their immune system is not functioning well because again, they are immunocompromised, immunosuppressed, okay, kana magikag surgery, or na underlying conditions such as HIV. Okay? Next, you have also increased use of invasive procedures. So example kanang mga mogamit og indwelling devices, na mga respirators, basta mga invasive procedures na in a way that could, harm, all right, the area kung asa nimo gi-insert or gibutang ang instrument, something, and once ma-harm siya, pwedeng maka-introduce og kagaw to the bloodstream, right? Or maka-introduce og normal flora ato na area to the blood vessels surrounding the area, which could lead to bacteremia. Okay? All right. And next, you have age of the patient, still the same, as mentioned, those that are really at the extreme ends of our ages ba? Those that are really young, babies, and those that are really old. So, katong ato mga grandparents, those elderly. All right? Okay. So, infants, adults older than 50 years, and of course, antimicrobial resistance. So, very self-explanatory because again, due to the indiscriminate use of antibiotics, so lisod na tambalan yung mga inana nakagaw. So, if ever your body is really like kanang have pathogens or like normal flora ba na nagka-develop ng antimicrobial resistance because of indiscriminate use of antibiotics, now if they are the ones now causing the disease, so pwede siyang lisod na ng tambalan. Okay? So, those are the risk factors. Medyo self-explanatory naman. Okay? Alright. Now, what are some of the organisms or the bacterial organisms that are associated with nosocomial? So, kanamakuha na to sa hospital. Okay? So, percentage is of course the cons, coagulase neg, so mga Staph epidermidis, Staph lugdunensis, tama ba? So, mga cons, alright? Next, you have, of course, Staph aureus pa rin, because again, the first two usually are normal flora of the skin, so pwede siyang ma-introduce in terms of mga instruments na ginabutang sa body, and all that, okay? Enterococcus, Candida albicans. Ang Candida albicans is based daw on a 20,000 study, okay? And Candida albicans causes fungemia. So when you say fungemia, ang fungi ang naa sa blood, alright? So fungemia, okay? So lahi na siya sa bacteremia. So by the name itself, still the same, fungemia, ang fungi within the blood, okay? Then you have the enterics, E. coli, Kleb, Pseudomonas. Of course, iba na po si Pseudomonas. Serratia, and si Acinetobacter. So, kamantay mo na again, the first two usually are normal flora of the skin because again, they can be introduced through invasive procedures or sa contamination ba or mga inana. Alright? Okay. Now, what are some signs and symptoms if a patient is experiencing bacteremia? Now, of course, shaking chills, fever, of course, that's expected because again, there's an infection within the body. So, normal reaction of the body is to have fever. Okay? Now you have hypotension, so mubabay ang low blood pressure, di ba? Prostration, extreme weakness, and diaphoresis or siging gisingot. Singtanan man ko pero wala ra. I'm always sweating but dili man po dagay, no? All right. Tachypnea, all right? Tachypnea or like abnormal rapid breathing. So muna early signs. So naglisod na siya ginhawa, like paspas imong pag-breathe. Na respiratory distress, delirium, stupor or agitation with nausea and vomiting, and acute renal failure with oliguria, decreased urine output, or anuria, wala na urine. So, as you can see, usually ang iyahang symptoms are systemic or those that dili jud mo point out in one system ba, respiratory system ba, or cardiovascular. So, as you can see, pwedeng na ay central nervous system, CNS na involvement, delirium, inana. Pwede pong na ay cardiovascular, mga hypotension, respiratory, tachypnea, respiratory distress. So these are usually some of the symptoms that are, that are indicative of a bacteremia. Okay, so medyo generalize the symptoms. So it would depend on the doctor kung unsa yung next action. Okay, all right. Okay, ayan. Now, some indicative clinical laboratory values. So pwedeng mga laboratory values, okay, that can indicate na pwedeng the patient is experiencing bacteremia. But again, it's not saying na kani siya, if ma-experience ni mo ni siya, or makita mo na lab values, diretso yun na blood culture. Dili ha, it's just some of the blood laboratory values na pwedeng ma-encounter in a patient who is experiencing bacteremia. Okay, so first one is thrombocytopenia, of course, low platelet count. Okay, next you have leukocytosis or leukopenia, either increased WBCs or decreased WBCs, so depending sa pathogen. You have lactic acidosis, hypoglycemia, hyper, abnormal liver function tests, especially hyperbilirubinemia, so increase yung bilirubin. Coagulopathy, meaning ma-activate yung coagulation system, so na yung mga clots na ma-form, alright, or poor ba yung clotting, inana, kaya na-affected yung coagulation mechanisms. You have also DIC, disseminated intravascular coagulation. Now, DIC is like disseminated intravascular coagulation, meaning it's everywhere. Naakay clots na mahitabo, and it's quite deadly also. And DIC is a characteristic food or seen usually a sequelae or a complication na of Neisseria meningitidis na infections. Okay? Ang DIC, meningitidis. Alright. Neisseria meningitidis, di ba? Kanisa na infection sa Neisseria meningitidis, pwedeng, like kanang meningitis caused by Neisseria meningitidis, it can lead to DIC. Alright? Okay. Okay. So, you'll have more of this DIC in your second sem sa hematology. Alright? Because coagulation na yung i-discuss sa Hema 2, which is much easier siya compared sa Hema 1 if ako ipa-decide. Alright, okay. And next, we have elevations in CRP, haptoglobin, and fibrinogen. Now, I'm not sure if na-mention ba sa Clean Chem, but CRP, haptoglobin, fibrinogen are example of your acute phase reactants. Okay, APRs. Acute phase reactants. Okay, so these are substances in the body that usually increase, okay? Mo increase sila in terms of na mga infection or inflammation. Okay? You'll have more of this sa inyong IS, di ba, sa second sem, immunocero. Alright? Particularly CRP. CRP is considered to be the primary or siya jud ang musakaw intense in terms of infection, ang CRP. Siya jud significant og amount na mo increase. Alright? Mga acute phase reactants. And we also have a test in clinical chemistry that would also indicate na ay bacterial, bacteremia ang patient, okay? And that is your procalcitonin, okay? Alright, or procal, okay? Kanin siya na-discover na ko siya sa internship. Kaning point, like unsay purpose of procalcitonin or procal. Again, it's usually for sepsis, to detect if is it padulong na ba siya severe sepsis, ang procal. Okay? So, ang procal mo indicate siya if ang sepsis ba is padulong nag-severe sepsis or if the patient really has sepsis. Parang ganun, if I'm not mistaken, ha? Alright. Pero, again, ang point sa procal or procalcitonin, unsa iyang purpose, it's for detection of sepsis or for sepsis. Okay? Please take note. Sa internship rin ako na siya nahibalaan sa iyang purpose. Kaysa third year ko sa Clean Chem 1 and 2, I'm not sure if na-mention bang Sir Koloyan, but as far as I can remember, marag wala jud siya. So, sa internship na ako siya na-learn. Okay, so please take note, procalcitonin, it's like a biomarker, okay, or like a substance in your blood that can be detected or that can be tested for detection of sepsis or to determine the severity of sepsis ba. Not sure lang, nalimot ko sa yung ano jud ha, like exact function, pero as far as I know, it involves sepsis. Okay? Alright, procal. Alright. Ayan. Now, for the next part of the video of blood culture, we'll now talk about specimen collection. Okay? So, how do we collect blood for blood culture? Alright? Okay.